Personal Perspective. Desiree DeMello, the University of Arizona Global Campus, MPH 602, Social and Biological Determinants of Public Health, Professor Paulina Montalvo, March 28, 2022. Personal Perspective. A type of test that identifies changes in your chromosomes, genes, and proteins is referred to as genetic testing, or rather an analysis of your DNA, the body's hard drive that contains instructions for your body's functions. This type of genetic testing can detect changes in genes that could potentially evolve into an illness or disease. Over the years, genetic tracking or tracing has made new developments in detecting conditions and illnesses. I believe there are both positives and negatives to genetic tracing. On one hand, it would be great to know in advance if you will be at risk for obesity, bipolar disorder, breast cancer, ovarian cancer, vision loss, psoriasis, dyslexia, or Parkinson's disease. However, we know that genetics only accounts for 15% to 20% of the differences in human longevity, according to a study done on monozygotic and dizygotic twins, Bortz, 2005. Furthermore, according to Bortz, genes matter. However, their real significance lies not in their essence, but their interrelations with the other components of health, Bortz, 2005. With that said, if we know that our outcomes are not solely based on genetics and heavily influenced by social and environmental determinants, shouldn't we put more focus on correcting those underlying social and ecological determinants rather than forecasting poor health outcomes as a result of the environmental and social determinant exposures? Rather than forecasting and preparing for the disease, there should be more intentional effort on the cause of the cause, Bortz, 2005, and implementing of the necessary changes to support and improve health outcomes. We know that where we live matters and that changes in our lifestyle, behaviors, and diet can change our overall health, wellness, and significantly influence our health outcomes. In the United States, our healthcare spending has reached an all-time high of 19.7% of the gross domestic product, CMS 2019. Public health funding has continuously been cut over the years, and the lack of focus on prevention and health promotion in our healthcare systems has declined. Genetic testing could be a valuable and powerful tool as a driver of health promotion and prevention. However, will this testing indeed be available to all? Freeman and Wojcik, 2021. How will this testing be used? Will it help improve health outcomes, or will it be used to reduce access to needed services? Will it be a process of elimination or an equitable enhancement of health services? Some of the benefits of genetic testing is having individualized early interventions that address and treat the disease or the illness. Early interventions have the added benefit of cost savings and long-term health improvement outcomes. The downside to genetic testing is that not all insurance plans cover genetic testing. The results are not always precise and may not be reliable. Having a positive test result does not necessarily mean that you will or will not develop a disease or have immunity to an infection. Smith, 2008. In the United States, the healthcare model is built as a reactive model that treats disease and profits on the impacts of the disease. The United States healthcare system is not a model focused on prevention and health promotion. As public health professionals, we advocate for prevention and health promotion in hopes that we stop the disease from ever evolving. Genetic testing could be a tool used to collect data, identify, and implement solutions that address the potential health needs within the communities before they happen. It is a way that prevention and promotion could be implemented for a specific condition before it ever develops, a proactive approach instead of a reactive approach. Knowing that not all genes will be expressed, even if present, should be considered. There is more to learn about this and how the technology would be used. Genetic testing and tracing are powerful tools that could be extremely useful in public health. It could significantly impact the community's health outcomes. However, it could also be a tool to predetermine outcomes and modify services based on the results. It could be a tool to forecast revenue and cost savings based on genetic testing results. If this tool will be available to all and be utilized to improve the quality of life and health, I fully support these efforts. However, if this tool is used against our community's health and well-being, and individuals will be penalized for their possible outcomes, I would not support this initiative. Additional testing is needed to ensure accessibility and reliability are equitable to all.